Hi there, my name is Robin Murray and I'm a pelvic physiotherapist. I'm also an orthopedic physiotherapist and I work at Wellness Team on Queen. Tanya asked me to create a video to help basically talk about what I do and how I can help women achieve their pelvic goals, really. So my background in pelvic health is I started as an external pelvic floor physiotherapist for a few years, and then when I became a mom myself, I received my internal pelvic floor physiotherapy certification. This is an area of practice I feel quite strongly about, being a woman that has dealt with pelvic pain for a while, as a new mom, really wanting the best out of my pelvic health. So what do? I think a lot of people think that as a pelvic floor physiotherapist, my primary mode of exercise is Kegels. The pelvic floor and the pelvic area is quite complex, but I would say my treatments are relatively simple and easy to do. I essentially will assess how your back and spine is moving, how you are doing as a person overall. There's a lot of factors that go into both pain and urination, defecation. My paperwork's about 15 pages long, so it's quite extensive. So the first half of the session meeting me, we really talk about you, your goals, what brings you to see me, and based on that I design an assessment that would be the most appropriate given your primary list of concerns and what your goals are. So during an assessment, I often will look at how your spine is moving, how your pelvis is moving from a biomechanical standpoint, how your muscles are doing, how strong your muscles are, how weak your muscles are, how long your muscles are, how short they are, from an external standpoint. Also, we'll look at your breathing pattern. Breath dynamics are so important for our general health and definitely pelvic health, how the diaphragm and the pelvic floor work together. If clinically indicated, I will offer what is called an internal assessment. But that's not necessary for everybody. I treat a lot of patients that or clients that we never do internal assessments because my primary goal is to meet you exactly where you are and ensure that you're 100% comfortable and feel 100% safe in my care. For example, I've had a client yesterday I've been working with for 2 months, and we did our first internal pelvic assessment yesterday, and that was the right call for her. But if we do an internal pelvic floor assessment on day 1, I look at the external pelvic floor area, ask you breath contraction, things like that, and then with a glove lubricated finger I assess the pelvic floor musculature inside. I don't have my model with me today. If I did, I would show you all the muscles that I assess, but I'm looking for pain, changes in length and tension. I will assess strength of the pelvic floor, which is a Kegel or however you do a Kegel, depending if you've had multiple births or one birth. If you're postpartum, I would be assessing if there's any prolapsed tissue there and letting you know what that means and how to prevent it from getting worse in the future, depending if you're a lifter or CrossFitter or do yoga or just a general mom that is lifting and doing laundry and things like that. Gold standard assessment include rectal examination. Depending on the presentation, I'll offer this as a starting point if my patient's comfortable with it. It really depends on the person, and some people I never do rectal assessments with. The reason that rectal assessment is really a helpful tool for us is that a lot of the pelvic floor musculature assert onto the coccyx or the tailbone. So to assess those muscles correctly, rectal assessment is definitely clinically indicated for some people, but not everybody. So basically we can do all of it, none of it. Some patients we just talk the first session depending on the history, and that's okay. For my prenatal clientele that are looking at having a baby, whether it's their first, their second, their fourth, their seventh. What we really look at is how to prepare the body the best for birth, ensure that you remain active as long as possible, and why that's important, if that's part of your goals, that is. I give tips for if you have a C birth or a cesarean birth, how to recover from that, considerations, and I really support any woman's journey, whatever they feel is right for them, whether or not they have doula support or midwife support or OBGYN, C birth, V birth. For me, you were really important in what you think is right for you and your family. Postpartum, I usually recommend that my patients can come to see me before 6 weeks, but for an internal assessment, I usually wait until bleeding stops, which is generally around 6 weeks. I can do home visits through Wellness Team on Queen for my clientele if it's easier for them. The first couple weeks, I usually say about week 3, that I can come in and see you postpartum to give you some guidelines, some very gentle techniques, maybe get you back to yoga and give you some timelines and what you can respect for return to physical activity depending on your goals. Okay. Postpartum, it really depends on how your birth goes and what symptoms you're experiencing. Every woman is 100% different from one to the next. Some women will have issues with what's called urge incontinence, which is strong urgencies to urinate and then loss of control. That's usually not a weakness thing, that's a tightness thing, okay? Usually it can be a dietary issue. Stress incontinence, coughing, sneezing, and urination, jumping and urination is a different type of treatment that I do. I also treat women that are trauma survivors, endometriosis, IBS, internal cystitis, really any type of pelvic condition, and I do treat men as well for pelvic pain, post-prostatectomy, chronic constipation, things like that. So if you have any questions, you can always email me. Tanya has my email. I'd be happy to answer any questions anybody has. And I also have a Facebook page. If you search for Robin Murray, Robin with a Y, Murray physiotherapist, I'll pop on up. Pretty easy to locate with my glasses. And I also have an Instagram. I don't post very often, but I do post some tidbits regarding pelvic health, so you're more than welcome to follow me there. And my handle is pelvic physio mom, so that's pretty easy to find. So I hope this video was helpful, and again, if anybody ever has any questions, I'd be more than happy to answer them. Okay, bye.